RSV, or respiratory syncytial virus, usually leads to mild symptoms resembling those of a cold or flu, including cough, runny nose, fever, fatigue, and decreased appetite. In Ontario, babies born on or after January 1st, 2024 will be eligible to receive a free immunization against RSV as they enter their first full respiratory virus season. Joining me in the studio is Dr. Kaleem Ashraf, a pediatrician at Niagara Health. Dr. Ashraf, how common is RSV?
So RSV is the name of a virus called respiratory syncytial virus. It is a very seasonal virus and usually runs in the fall and winter of every year. That is correspond to somewhere around November to April. And it is one of the leading cause of most respiratory infection, especially in young children.
And how does it spread? I understand it spreads rather quickly.
Yeah, it is a very, very spreadable and very contagious virus. And like the other respiratory virus, it can spread from being with a person who is infected if the person is coughing and sneezing, but it also can be contacted by contacting an infected place. For example, if a person sneezes and virus can be on the table, and if I touch that table, I can get that virus. So it's called contact.
Okay, so very important to protect ourselves from getting the virus in the first place.
Absolutely.
And I understand in the past it was only available to preterm or vulnerable babies, but that's changing.
That's true.
And so what is Niagara Health doing differently?
So not only Niagara Health, but it's part of the initiative from the Health Canada and Ministry of Health. So yes, you're right, like up until last year, only the premature babies or highly vulnerable babies were getting the immunization, but those injections were like 5 injections with a monthly interval running between November to April. But for the first time, Niagara Health is providing now the immunization that is only 1 injection, and that covers the entire season for approximately 6 months.
And how are the results?
Results have been exceptionally well, not only in the lab, the research trials, but this product has been used in many different countries and shown exceptionally good results. And just to give you a perspective, for example, if we get this immunization, chances of getting RSV is 80% or more less. And even if we get the virus, despite of that, chances are that 90% of the time will not even require any hospitalization. Wow. And even the kids who get infection, the reduction of intensive care unit admission is more than 90%. So it is very effective way of protecting RSV.
So, you said not oftentimes, but it can lead to hospitalization. So what would you advise parents to look for? And when would you suggest they do, go to the emergency room versus waiting to speak to their GP?
So like any other respiratory viruses, for example, as you rightly mentioned, in the first place, the symptoms can be very, very mild, like runny nose, cold, cough, congestion, maybe low-grade fever, and child look a little bit tired. But on the other hand, it can be very serious. So especially the signs to look for any respiratory infection, in particular with RSV, is worsening cough. If the child looks like he's in respiratory distress, like belly is moving, baby is breathing very fast, and in more serious conditions, the baby start to look very tired, refuse to eat and drink, they can get dehydrated, and one of the more serious signs are that lips start to look blue, and they are looking very unwell. If that happens, immediately going to the emergency department or even calling EMS will be the better option.
Dr. Ashraf, where can parents go for more information about the immunization?
So a lot of the work was started even before this product was, or the immunization was available. So the information was spread to the public health and all the family doctors, including myself, because I have a very busy pediatric office. I've started talking about this at least 2 to 3 months in advance. Mm-hmm. And now Niagara Health System, because OB-GYN and pediatric work hand in hand, so most of the mommies who are pregnant about to give birth, so the team started to talk to them about that, to get their babies immunized. And now what is happening when the babies are born, majority of the babies we are offering to everybody. All babies are born and they can get this immunization prior to even the discharge home for the first time. Okay. So we talk, all the nurses, when the baby is born, we give them all the information. Posters are available in each room, and we are ready to answer all the questions that parent might have. But I also know that if this is a new thing for the parent and is not sure, it's not that if they didn't get the vaccine or immunization, before they get home, they can still get it from all the primary care providers, the community pediatrician, and also public health.
And is this immunization recommended for just babies or for children of all ages?
So no, because we know RSV virus is more making sick for the younger babies, like under 1 year of age and under 2 years of age for the most part. So previously it was only for premature babies, but now all babies are born January 1st, 2024 onward, and also all the babies are born in the RSV season. Okay. They're all under 1 year of age, they're all eligible to get it.
All right. So for those who didn't get the immunization at the hospital, where can they go to get information, and where can they go to get the immunization?
As I mentioned, like all the primary care providers, their family doctors have it. If some of the family doctor, for some reason, if they could not get it, then community pediatrician always have this immunization available, but public health is the best resource. There are lists available for many different places, and one of the important places, Niagara Health Community Health Center, also can provide vaccine even for the families who are not rostered or registered with them.
Great, wonderful. So the message is get out, get that vaccination, protect your babies. Dr. Ashraf, thank you so much for being here today.
Very welcome, very welcome. All right.